Hi everyone, I'm Shadi Waba, CEO and co-founder of Ember Medical. When I was 18 years old, I lost my best friend to cardiac arrest, and I think a lot of people had similar experiences because about every 90 seconds, there's an American that suffers a cardiac arrest, and these people have only 5 minutes to receive CPR and defibrillation to prevent any permanent damage that can happen to their brains. Unfortunately, the ambulance response times are between 8 to 14 minutes, up to 30 minutes in some rural areas, resulting in the low 10% survival rates. But there is hope. 1 in every 5 Americans are CPR certified. If they only know that there's a patient suffering cardiac arrest near them, this can make a significant difference. And this is exactly what we built. When a patient suffers a cardiac arrest and our network is alerted, we use geolocation and crowdsourcing technologies to find the nearest provider to them and send them an alert message that there's somebody that needs their help. And then once they respond, we guide them to where the location of the patient exactly so that they can start administering CPR until the ambulance arrives. And thus, we can be the safety net of the 92 million Americans that have cardiovascular diseases. And the good thing about our system that it can be alerted through many things, through our app or through 911 dispatchers or any IoT devices like Google Assistant or even medical monitor device that is at home and is connected to the internet. With that system in place, we don't have to only stop at cardiac arrest. We can actually expand that to other time-sensitive emergencies that affect about 1 million other Americans, such as opioid overdose, hypoglycemia, and anaphylactic shocks. And we can prepare them with a small kit that is equipped with the medical tools that they need to provide such help. But also there's another problem that when the EMT are there, they need to have a live connection between the patients and also between them and the EDs. So they can tell the patients or their caregivers what to do until they arrive, or they can consult with the ED about something that is beyond their expertise. And that's why we built this telehealth solution that have a video and audio connection where they can text or talk to them before they reach or once they are on the scene. And with that thing in place, we can build it to help with the problem with the avoidable ER and urgent care visits, which is making every place very crowded and costs us about $4.4 billion a year. And our business model is simple. The providers, they work as freelancers, they work whenever they want, and they pay per response, and we charge the insurance, which they found that this is a very interesting model for them because they can save a lot of money on the long run if a permanent damage happened to the patients. We have been working for about a year, and we have raised about $1 million that we will use to achieve these milestones, which mainly is about expanding our network, saving as many lives as we can, and have an international reach. So I have an engineering background and was involved with startup communities for a while, and my co-founder is a cardiologist with degrees from Johns Hopkins and Cleveland Clinic. And we also have a very good team of developers and marketeers working tirelessly to actually achieve our vision, which is delivering affordable medical care to you and your loved ones when you need it the most. And thank you so much.
All right, questions from our judges.
Interesting idea. I like the idea of crowdsourcing responses from people. But my question for you is, if you're paying people to respond, what kind of liability does it open up for the people responding?
That's a great question and has been in our minds from day one. That's why we have a malpractice insurance covering all the interactions through our app. So anybody that responds through our app is covered by this malpractice insurance. And it's not hugely expensive as we think, because most of these emergency situations, if it's doing something to make them survive, or if you didn't do anything, they will just die. So we have thought about this problem and have that in place.
Thank you for your presentation. So I just wanted to clarify. So one of the use cases is crowdsourcing CPR, correct? For people who have cardiac arrest, for anybody in the vicinity.
Yes.
In that case, how is it that people have decided to respond? I think here especially people are protected under a Good Samaritan law, but they may not feel like they would want to step in. That tends to be a problem of human nature. How have you found that to be true, and how are you I guess, can you speak to that a little bit? 'Cause I
Yeah,
think
yeah,
that's a
sure.
big
That's a very
question.
good question. And actually, when we started building the network, we were thinking that we can go to anybody with a CPR certification. But we found that most of people that actually have the medical training, they tend more to register with us. And that's why now most of our network is like nurses, paramedics, and physicians. And you're right. Like the other normal people, they will be like, I don't want to do something that will come back to me. But I mean, with the all awareness coming out about the CPR and people getting trained and how you can save a life, it's actually it's now something more that people would like to do.
And for the second use case of using medics, are these medics who are actually on a truck coming to help out and using the telehealth platform, or are they medics who just happen to be in the area and are calling in for help?
So everything here is app based. So anybody, they don't have to be on a truck. So let's say that one of the medics responded and says, I'm going to this person because I'm near him, I can walk and go. But they reach the patient and let's say they have some kind of a stroke that they don't know what to do now. So they can actually talk to the ED because, there's something that I may mismention. Every time we do a respond of emergency, we actually send an alert to 911 too. So there's an ambulance coming anyways. So they can actually communicate with the pro.
Thank
Yeah.
you.
I agree. I mean, I think that the crowdsourcing idea for resuscitation is a very cool concept.
Thank you.
I guess my question is the way I've interpreted this, and I appreciate that you've made it so that you can initiate from the 911 dispatcher as well, but it's only as good as the number of people that have the application to receive the notification that something is happening. So, and am I right in understanding that the telemedicine portion will be for the patient, for the providers that get compensated for responding, but any layperson could download this app who has CPR training and respond? So what's your goal? How do you plan on scaling to get this application on every person's personal device so they know to respond? I mean, that seems to be the biggest hurdle to climb.
That's an amazing question, and this is actually the maybe in other even fields that's always the problem of crowdsourcing. But the good thing is that we are trying to partnership most with institutions that they already have people under working for them, and they will actually market for us. Okay, we have this app. They are our partners, so have it with you, so we can serve our patients better.
And have you implemented this already?
So yeah, we have implemented that. We are going to market in Egypt. That's the international one. Like in actually next week, then we will start. And now we are working with some clinics in Louisiana to have that also implemented there.
And have you had test use cases? Have you had end users use the
We
application?
we have piloted the whole telehealth part and a little bit of the emergency part again in Egypt in April, and it was very robust system. So that's why we are now confident to go to the market with it. Yeah.
I just have one question. If somebody had a cardiac arrest, how is the alert made?
So here we depend on that everybody have like someone around them that they will push the alert itself,
okay.
or with monitoring systems. So now, as you know, that the Apple Watches and they can sense your.
Oh, do you integrate with?
We integrate with anything with IoT. We actually spend some time R&Ds with R&Ding with the old Apple Watch. It was working to an extent, but their new version is amazing. It actually knows and it can alert our system. Yeah.
Okay.
All right. Thank you, Shadi.
Thank you so much.
Thank you to Ember Medical.